Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alala Yusuf. Lassa fever was an ongoing concern throughout 2024. According to the NCDC situation report, by December 15th, confirmed cases were 1,187, out of which there were 191 deaths. Within a week, confirmed cases have increased by 50 persons to 1,237, and there have been 12 more deaths. That's quite an escalation. Endemic regions for Lassa fever are Bauchi, Ondo, Taraba, Ebonyi, and Enugu states. But cases are reported from 28 states across the country, claiming more local government areas than it did last year. Can Lassa fever be more contained than it is currently? With me is a public health physician and chief consultant epidemiologist, Department of Public Health, Federal Ministry of Health, Abuja, Dr. Ganiu Jamiu. You're welcome to the show.
Thank you very much for having me.
Now, the outbreak this year is just as bad as last year, but the spread is a concern. 139 local government areas. Are we missing something? Because we've been fighting this Lassa fever for years.
Yeah.
What is going on?
Well, I won't want to say we are missing something. Whether we like it or not, Lassa fever is an endemic disease at the moment in Nigeria. It's just that we are at the peak, the period at which we record more of cases, usually during dry season from December to March. And you have to agree with me that there are some factors that usually lead to sudden increase, considering the fact that in terms of transmission, we have animal to human transmission and human to human.
Human to human.
But when it comes to animal to human, there are some factors, like for instance, some activities that kind of encourage human interfacing with the rats, the multi-mammate rats. So, like for instance, during those that hunt for those rats, bush bunny hunting for rats, and during dry season.
Do they burn the bush to hunt for the rats?
Yes, because that is the.
People will think you're just saying bush burning is one textbook thing. I actually saw people burning bushes.
Yes, because that's the only way the rats can come out.
Why?
Yeah, that's the way. That's the only way.
Can't they set traps?
Well, some people do that. But the point I'm trying to make is the fact that, during dry season, some of these rats, where they normally hide, because of the dry season situation, some of them want to move into houses and so on. And when they move to houses, what they try to do is that they normally defecate or urinate on either food items in an effort to get food to eat, or on surfaces where women can have contact with them. So that can be some of the risk factors. Then, if you look at our recent, we are now recording more of cases among health workers. That is the danger because of the infection prevention and control practices. It's like after the COVID-19, our infection prevention and control practices has reduced remarkably.
We spoke extensively about infection prevention and control measures in the hospitals. Yeah. And some of this was going on during COVID-19. Yeah. I know that this year, I've been to one or two hospitals to see a doctor, and I was impressed. My seat was so far away from the doctor, but we could talk across, you know. I said, well, I understand why I'm being kept here, even though some people may not understand, like, why are you keeping me so far away? Do I have a disease? But tell us some of these IPC measures, just for the public to understand. For example, if the doctor says sit over there, it's not because he's being rude or he's being proud. It's just an IPC measure, right?
Yeah. One key thing about IPC measure is that what we call universal standard precaution. And what that one means is that you treat every patient coming as a risk until proven otherwise. Every patient you are seeing. And I want to believe that what that doctor was trying to apply, so that he tried to ensure that he minimized it by maintaining the distance. Because every patient coming is a potential risk.
That's COVID-19 distance, right?
Yeah.
Of 2 meters.
Exactly. He was just trying to be, it's part of IPC, universal a standard precaution, which you try to maintain certain distance. And in terms of patient contact, you need to have some gadgets, like personal protective equipment, like glove, masks, and so on, just to make sure that, and that has to do with the likely risk, potential danger somebody can be exposed.
Okay, but let's be practical here.
Yes.
Let's say a patient comes and the person actually has Lassa fever.
Yes.
Just came, and is complaining or whatever, and has Lassa fever.
Yeah.
If the doctor has donned gloves and a mask, isn't that sufficient?
No, you need to put gown, boots, and so on. The purpose of
he doesn't know. You're coming to, this is your first contact.
Yeah.
You just came, you signed at the desk and whatnot.
Yeah.
And they say, okay, sit down, you soon see the doctor.
Yeah.
By the way, sit down.
Yeah.
You're sitting down with other patients and you're rubbing bodies. That's another thing.
That's another thing.
Then you go see the doctor. He's wearing gloves and a mask. Is that okay
for that time?
For
that time, because he wasn't sure of the diagnosis of that patient.
Okay.
I think it should be enough. And in such situation, after diagnosis, the next thing is what? But you cannot easily, another thing I want to say is that you cannot easily diagnose Lassa fever in any hospital. There are special centers for that, treatment center.
Definitely.
Like in Ondona, we have Federal Medical Center Owo. We have Irua Specialist Hospital in Edo State. So that's another challenge.
So you cannot say that a patient has Lassa fever until the sample has gone to that
exactly. You can
come back with the results.
Exactly. You can only say somebody is a suspected case until when you have collected sample and diagnosis have been made using either PCR.
So in the meantime, what makes the doctor suspect that
based on based on the symptoms. One thing is that they can present with fever just like malaria. They can have weakness, tiredness. They can have arthralgia, that is joint pains and so on. It's only in severe cases that you can start having people having bleeding, symptoms suggestive of bleeding from the orifices. There's some may complain of difficulty in breathing because they have what you call retrosternal chest pain. And another thing that they can have hypotension, that is low blood pressure. Okay. So these are some of the...
But these are the more advanced
stage. So one thing I want to tell you again that is actually aggravating the situation is that most cases present, when they have symptoms, they thought they have malaria. Some think they have typhoid.
Okay, let's cut people some slack.
Yes.
They say that seeing a doctor is expensive, medication is expensive. What if somebody has these symptoms and assumes that he has malaria, which usually people do, and starts treatment?
Yeah.
When you're getting treated for malaria, after how many days do you start to feel better?
Okay. Usually, malaria, the standard dose is 3 days, the ACT that we use. So you expect somebody by 3, 4, 5 days to start getting better. Yeah.
I thought it's after the first day you start
No,
feeling...
some may say no. It depends on individual. Some may have a relief of symptoms after first day, some second. Some may even say I've seen
this
cases.
Is very dangerous.
Yes.
Because if you're treating malaria and it's Lassa fever, then we're moving on to severity. Yeah. Because we're told the incubation time is 2 to 12 days or something like that.
No, it's 7 to 21 days.
7 to 21 days.
Yes.
When does it become dangerous?
Yes. When you start it becomes dangerous when somebody is complaining of severe symptoms like those bleeding. I'm
talking about like a range of time.
Let's say from usually within by 2 weeks or so, 7 to 14 days. But why I may be concerned with that period is the fact that most cases, prognosis, better outcome come when somebody presents early.
That means something has to be done about malaria testing.
Exactly.
If malaria testing is cheap enough, then the person can quickly rush for a malaria test. If that is negative, even the person with the symptoms can begin to suspect that it might be something else.
Well, it now depends, because there is this notion, even during COVID-19, when people present with fever, all those symptoms I just mentioned, the first thing people think of is malaria, then typhoid. And I'm sorry to say, some health workers are not helping matters again. that when you go, it's either when you go to private some facilities, it's either malaria or typhoid. So there is that general assumption. And to even cut it short, some don't even go to the health center. They don't go to hospital. They go to pharmacies where some are assumed to be doctors and they'll be treating that. And we also want to add to the fact that there is this concept of self-medication. Many people won't just go, the moment they just feel some slight feverish, fever and so on, they'll just go to the pharmacy. So these are some of the challenges. So at times, by the time some people present suggestive of Lassa fever, at times it may be too late. It is said that whatever treatment we may want to apply, like the ribavirin and so on, because the outcome, when an individual is administered with that, depends on early presentation. By the time somebody is coming after 1 week, 5 weeks,
the damage is
done. And so these are some
What is this damage? What are the complications
with
of Lassa fever?
Lassa fever, as I've mentioned, bleeding, that somebody can bleed and may have anemia. Then another thing, that some people may have severe hypotension, that is low blood pressure. Then another thing is that the long-time effect, which may vary. It could be complete or partial ear loss. So these are some of the
hearing loss.
Yeah, hearing loss. Then finally is death. The ultimate complication is death.
So a person can actually be deaf in both ears?
Yeah, it depends. And as I've said, the hearing loss may be either reversible or not reversible. It has been established that about 25% of those that have it may end up having hearing loss. Out of that 25%, 50% may recover, when about 50% may not recover. And one thing I want to talk again about fatality is about 1% of people may end up, dying from it. That is in normal cases.
But the current outbreak
during outbreak
is about 16%.
Yes, I'm coming to that. During outbreak, you may have case fatality up to like 50%. Then in pregnancy, those that are pregnant among pregnant women, the fatality may be up to about 80%.
Okay, so you've brought up a lot of issues.
Yes.
Now. Let me start with the
ribavirin, yes.
The medication.
Yes.
It's supposed to be the treatment for Lassa fever. But WHO is saying something like, we're not really sure. What's bringing that up?
Yes, it's not. That's what I want to say. Is that in terms of acceptability, or in terms of the effectiveness of that, it has been established that in terms of treatment, using that is dicey. In some individual, it has been established that when they come early, they do well. When in some, they even said the ribavirin aggravate their symptoms. So I agree with what WHO says is actual fact about ribavirin.
So some people won't respond as well as others.
Exactly. Some even get more complicated. The symptoms get worse when they even use them. When some will recover from it, and based on available evidence, that we show that those that even do well on that are those people that present early. Within 5 days or so, they may
That
do
is
well.
not a Nigerian trait, I'm afraid to say.
I agree.
Presenting early.
I agree.
But let's go to the next thing.
Yes.
There's been a lot of talk for so many years about a vaccine, even before Mpox became an issue. And look, we have Mpox vaccines. So we have Mpox vaccines. But we don't have any Lassa fever vaccine.
I agree with you.
Where are we on that?
Well, there have been a lot of...
You just hold that. We'll go for a short break and you answer when we come back. Let's go for a short break. Meet us on the other side. Welcome back. We're still on Health Matters, discussing Lassa fever. And we were saying that this year we have a wider spread of the disease, more local governments involved with Lassa fever, and it's been a concern from the beginning of the year. I'm here with Dr. Jamiu Ganiyu, and he's been answering our questions. If you have any questions on the topic, the number to call is 0808-054-2233. You can also send a message at CTV_Mary A. That's X, and you can send email to moalale@channelstv.com. Before we went on the break, we were talking about the question of the vaccine.
Yes. I think the game changer to this, concerning some of these challenges with diagnosis, late presentation, behavioral change issue and so on. So I think the best, I agree with you, is for us to have a vaccine for it. And I want to tell you there will be an ongoing effort to do that. I'm aware of the ongoing clinical trial in Nigeria. Being carried out in about, four centers? I don't. One in Imo State, we have Bauchi, we have in Ondo, then in Abuja, and I think is in stage 2 at the moment.
Stage 2? Stage
2.
Okay, so after that we're going to have stage 3, and then we are good to go.
Good to go. So,
good.
So there
That's
are,
progress.
and it is the study is being carried out by the government in collaboration with partners and so on. So I think we are very hopeful that something good will come out of it. And that
how really, long do you think it's going to take from?
Honestly, I say it's in stage 2 now. Do you know what that stage 2 means? It means that we
that's
are just,
animals?
No, it's human, but it's about, we are just using about sample about more than about 100.
Okay, so then stage 3 will now be a larger sample.
Larger size. So the stage 2 has to do with trying to establish the best dose. We feel that vaccine will be appropriate to be able to, develop, to be effective. Then looking at the side effects, studying the side effects, the pharmacokinetics, that is how will it react in the body and so on. So I think that is the stage at which they are at the moment. So we hope that if they're able to pass through the stage 2, then there will be stage 3, which will be where the
because
actual...
I don't know about you, but Lassa fever seems to be more of a threat to us than Mpox.
I agree with you 100%.
So we really should get that vaccine out.
We are very hopeful too, honestly.
But tell us, can a person, through self-effort, avoid Lassa fever? And
yes.
How?
Yes. Like as I mentioned, we look at it animal-human transmission. As I've said, ensuring that there's proper storage of our food stuff at home. It may be stored in rat-proof containers. We ensure that there's proper environmental sanitation so that we ward off rats. And where it is not possible, we can do rat eradication using some of these chemicals and so on, which are not injurious.
That's around the house.
Around the house. You can
Let
fumigate.
me tell you what I did.
You can fumigate.
When Lassa fever began to look like a threat in Lagos, I bought myself buckets, plastic buckets.
Yes.
And that's where I put my food.
That's fantastic.
Right, all the dry food, rice, and all that stuff. Yeah. Because they can chew through those bags, can't they?
I agree. I've seen it on many occasions. They do that. And it's on homes that they have cats. I'm not encouraging anybody to have cats in their homes. So that can also serve to
that can help.
It can help
if you are a cat lover.
Exactly. That is all.
But students, you cannot tell students not to drink Gary.
Yeah.
And some of this Gary is spread on the ground.
I agree with you.
In very funny situations.
Yes.
The day I told my daughter, there's a lot of problem, and where you're schooling, in the boarding house, that's one of the endemic areas.
Yeah.
No Gary for now. There was almost a riot in the house. She said no. She's buying hers from a factory. Yeah. Now, does this happen?
Yeah, it happens. I think for me, even me, I would prefer to buy it from a factory where it's well packed, because I'm very sure of that. Because we've had cases of people who drank Gary and that was the source of how they got Lassa fever. So while we use this opportunity to also advise those people that dry, they can dry it in a container, maybe in a rat-proof whatever under the sun. That may help also as to prevent contamination with the rat feces, urine, and so on. I think that would be another good way we can also spread this information to the people, especially in the rural areas, that there is the danger. There's a great danger in just spreading food item in an open space where...
But then again, they should be taught how they can spread it in a safe way, because it needs to dry.
I think so. That's a good one.
There's a lot to look at.
I agree with you. There is a lot. And looking at the aspect, we are just talking about animal-human now. Looking at the human-human transmission, the IPC, I just mentioned certain precaution. Apart from behavior, we have to, when you are talking about IPC, we have to look at behavioral change. Some people have adapted the system, but in terms of maintenance,
yes,
how do they get some of this commodity to work? You go to some facility, no glove, nothing. And again, before you know, and again, some people present such a way that you not even have that high index of suspicion that is Lassa until they have messed up with the secretion, blood, and so on. Many people have gotten contaminated, infected, and so on. That has been the true picture in some of their facilities. So we need to, apart from training on IPC, we need to continue to sensitize the general public, health workers, that we should have that high index of suspicion whenever anybody is presenting with symptoms. Some may not have fever. They might have taken,
some come without fever.
Yeah, they will have taken an adjective and so on. That especially since we are now having an upsurge, that should have high index of suspicion, whereby anybody that's coming, our IPC should be at the back of our mind and try to see that we take sample as early as possible if we are suspecting something related to malaria, typhoid, and so on, so that sample can be sent to the appropriate place. Then another thing I will also advise is that apart from, we have very few treatment centers, maybe that may need to scale up. Especially, you can't imagine somebody in the rural area, maybe he's living
waiting for a sample from Irua.
Or maybe he's in a village that he has to spend about 34 hours to assess treatment.
To even go to the hospital where the sample will be taken.
Exactly. So these are things we actually maybe to scale up some of the treatment centers.
Definitely.
And again,
because if we say it's endemic to West Africa,
yeah.
I think we should take ownership.
Yeah, and again, innovation. We need to develop a kind of innovative ideas. Like maybe the test kits, maybe there's a way we can have some of the rapid test kits that we can just use to have an idea. Maybe
exactly.
Then before
if a rapid test kit can be made for HIV, can be made for COVID, they should make one for Lassa fever. So it's that important.
I agree with you. So that we can, by the time maybe the first use a rapid test kit is showing positivity, that person may not be maybe sent to either the treatment center for confirmatory test using PCR or So I think those are areas I think. All the major stakeholders we need to look into that and so on. But as I've said, hopefully if we're able to have a vaccine, it will go a long way in arresting some of these challenges that
stage 2. I'm so happy that a vaccine is in stage 2.
Is in stage 2 now,
so right after now. Stage 3, we're good to go.
We're hoping to get to
Let's
stage
just 3. See how it goes.
Yes.
Yes,
thank you.
But how much of our infant and maternal mortality is attributable to Lassa fever? I was alarmed when I heard that it could be up to 80% in pregnant women. That means that if 100 pregnant women have Lassa fever, 80 could die.
Yes. Let me now tell you, God forbid, maybe you have somebody who is infected. One thing about the virus is that it has that high affinity for the placenta, vascular system and so on. So usually when a woman is infected, we try to save the life of that woman.
The baby, 80%.
Because, the baby, but what matters at that time is, the chances of the baby surviving is 10%.
That's what I mean.
Yes, 10%.
The chances of the baby dying are higher than the chances of the mother dying.
But usually what we try to do is the mother.
Save the mother.
Save the mother.
But why can't you save the 2?
Yeah, we'll try as much as possible, but we are not saying the 2 does not matter. But in most cases, it's because the fatality tends to be higher among mother, that 80%. So that's why we try to say we can survey the mother. But if we can do fine, but if we can, the mother first, so that she can have opportunity to have another baby next time. So those have been the approaches.
High index of suspicion.
Yes.
The best news I've heard today is that vaccine is in stage 2.
It's in stage 2.
So we've come to the end of the show. Thank you so much, Doctor, for coming on the show.
Thank you so much.
Thank you very much for being there with us. If you haven't learned anything today, just remember 2 things. You can save yourself from Lassa fever by your behavior, and there's a vaccine in stage 2. Have a wonderful day. I'm Mary Alale Yusuf.